This will be a very small number of people because when you go in and get your first vaccination, you know you need to get your second dose. People are anxious to get that. So we expect this to be a small segment of the population, but it is important that it emphasizes get the vaccine, get your second dose, make sure you follow up and fulfill your obligation or your appointment time to get that second dose. With that, let me go to the vaccination report that we'll put up first. And again, we're in phase 1B, having finished 1A. And in 1B, you can see that we've, right in the middle, we've received totally 651,000 doses of the vaccines, and we've given out 413,000. People ask, where is the excess there? Well, it's in the pipeline to get out. Sometimes those are second doses, but the first doses are getting into the arms of our Kansans within 72 hours, and we're pushing to continue to improve that. You can see the continued flow of vaccines on the top left, that we've received 40,700 vaccines in the last 24 hours. We've given out 12,000, and that's 65% under the state efforts. The federal program through CVS and Walgreens is a slower process. They're keeping back for second doses, but that's gradually increasing up to 42%. And so we're going to be adding to that some additional work through the community centers as well as through the federal pharmacy program that will continue our efforts to get those vaccines out as quickly as possible. And then let's go on to our case report. The last 24 hours we've had 1,475 new cases, but we've had a reduction in active cases by 422, which continues to be good news. I keep waiting for the death report to go down. 42 deaths is too high based upon the number of cases that we have. It had been going down the last couple of days, but it's back up to 42 today, which is a sad note on this report. In terms of our hospitalizations on the right, you can see a reduction by 2, and so that's continues to stay flat. Hopefully that will continue in the right direction. Ventilators is a small reduction as well. And so the cases, if you put it in perspective, we continue to have reduced our new cases, but over the last week it's flattened out, and it's good that we've reduced it down, and but we want it to continue to go down, and it's a reminder that if we don't take the right precautions, then the spread will continue, the cases will go up, and we'll be back in a very bad situation. Let's go on just to show it in graphic forms. The 7-day rolling average of confirmed and probable cases, right trajectory there as you can see. The next one is the number of hospitalized COVID patients, down to 775, and that's the lowest it's been for some time. That's good news for our healthcare workers. The active number of cases, as I indicated, is going down very dramatically. And I look forward to the time that gets down to where it was back in early October. The next one shows by region, and I like to show this once a week just to show the different regions and the trajectory. If you look at the top, which is Northwest, you see that huge spike for Northwest Arkansas that has come down dramatically, and it's actually come down lower than the yellow, which is Central Arkansas. And so, but both of them have trended in a better direction. And then the blue, of course, is Northeast, that is coming down. And then the green and red has been consistently flat over time, a little bit up. The red, which is Southeast Arkansas, going down. And so progress in all those regions of the state. And then I'm going to leave that up there for Dr. Romero to talk about, but I'm going to end, if we can go to the video, I wanted to showcase our advertising effort with an ad that's on television.
This winter, we must bundle up, not just for warmth, but to control the spread of COVID-19. Wear a face covering, wash your hands, maintain a safe distance from others, and avoid crowded spaces. Get your flu shot now and the COVID-19 vaccine when it's available. We can get back to a better tomorrow by doing the right things today. Learn more at healthy.arkansas.gov.
It's a great message. We're spending $500,000 this month and next month in the media campaign. There's numerous ads that are out there, but I want to assure everyone that we're really marketing get your vaccine when it's your turn, and your turn will come soon. The vaccine supply is increasing. We're accelerating that the best we can. And with that, Dr. Romero, for your comments.
Thank you, Governor. Thank you for leaving me this last slide. I think we've reached an important milestone today. As you can see, there's a dotted or hatched line across that slide, and that represents 10% positivity rate. It is the rate that we have been striving to be below, and if you remember in the early part of the pandemic here in the state, we've always tried to be below that. You can see that it began to tick upward and passed above that 10% line in early November. I'm happy to report today that when combining both the positivity rate for our PCR tests and our antigen tests, we are for the first time under that. We're at 9.9. We hope to continue to see that go downward. It means that our efforts are working, that your efforts are working, and that we need to continue with the mitigation strategies which were already described by the governor and by the ad. Other issues that I think I would like to point out are that our active cases, as mentioned by the governor, have continued to drop, and that is a good sign. That means that we're not having as many positives added to the list, and we're starting to get more people off the list of active cases. So things are moving in the right direction. We can keep them moving as long as we continue our mitigation strategies, and our vaccines are moving outward. We're starting to get them into portions of the state where we have an equal distribution across the entire state, and we'll be working on that as we receive new vaccines. So I'll end here and turn it back over to the governor. Thank you, Governor.
Thank you, Jose. And in order to make sure we have an opportunity to get to as many questions as we can, I've asked Secretary Key and Secretary Preston and Colonel Ader to be available if there's questions in those fields that they can answer, but we did want to have more time for questions today, and so we'll turn it open.
In terms of the Walmart program, do you know after this week, is that how many each week we're going to be, how many doses they're going to be getting?
There should be a consistent supply. There's not any guarantee that it'll be increased, but the pattern has been that they're not going to decrease that supply. So that's my expectation, that there will be a consistent supply, but as to whether that will be increased will be a week-by-week information that we receive.
Do you expect it to be at least 11,000 per week?
That's correct. Colonel?
Yes, sir.
Yeah, so I think it's 11,500. 11,600 doses.
And in terms of our allocation for next week, have you found out how much that'll be?
Colonel, why don't you address that?
Yes, sir. Well, thank you, sir. So what we've seen over the last 3 weeks, we saw the 16% increase, and we expect that to stay the same. For at least 3 weeks, we also saw a 5% bump. And now when you talk about the increase with the National Retail Pharmacy Program, altogether that increases the volume of coming into the state of about 40%. So we've been very, very successful in the second line of effort that we've been trying to do is increase the rapidity of the vaccine coming in the state. So we kind of expect that to be the case for a while. And really kind of the next big thing is that we're trying to get better information on any kind of new vaccine that would be introduced. We don't have any idea of the real timing on that or the allocation coming into the state, but we're preparing for that and figuring out how best to deploy that. Sir.
Thank you, Colonel. And let me add, I actually failed to mention this, that on my call with the coronavirus task force, that we were advised that there will be, in addition to the state allocation, nationally of 500,000. I believe that's the number. And so that's a smaller increase that we've seen before with 16% and 5%, but there will be a small increase for next week.
Any idea when we'll be at the point that you could add other groups from 1B into the...
We've had discussions on that. We're not prepared to make any announcement. We have to get further into the 70-plus population. Right now, there's too much of a waiting list. There's a greater need there, and so we want to get deeper into that population before we move into additional segments. I do believe that by March 1, we will be able to make additional steps into 1B. But we're going to be monitoring it between now and then to see if that needs to be adjusted anyway.
Groups will be next?
We'll keep you informed. Otherwise, they'll be lining up early. Are there any questions remotely?
Yes, Governor. Hi. Ladner from Hot Springs, KZNG. I noted a national article this morning that per capita ranks Arkansas again number 11 in the nation in getting doses into arms. Does the effectiveness of the program impact your our allocation in Arkansas from the White House task force week to week?
No, it doesn't. Right now, it is strictly on a per capita basis. But it does impact our credibility, the confidence level, the partnership. And so we do get accolades for how we are effectively getting the vaccination out. And that is confidence building for what we're doing in this state and increases our partnership. But right now, and I expect that to continue, that it is on a per capita basis. We're going to watch that very closely if that veers from that.
Governor, it's Michael Hebling from KUAR Public Radio in Little Rock. I wanted to ask your thoughts on a story I'm working on based on an encounter I had over the weekend at a fast food restaurant in southwest Arkansas. No employees inside this restaurant in Texarkana, Arkansas were wearing masks, no social distancing. I asked a manager about this who told me there is no requirement to wear masks, and that the owner of the franchise, who owns several restaurants in the state, told employees they don't have to do so, so they don't. I interviewed someone with the Department of Health yesterday who contradicted that, said your directive still mandates that any restaurant worker who works with the public must wear a mask. He said they would investigate my complaint and send someone to the restaurant. But my question to you is, how do you feel when parts of your directive are disregarded by businesses, putting employees and the public at risk?
Was that a Texarkana, Arkansas, or Texarkana, Texas restaurant?
It was Arkansas. It was on the Arkansas side. And same person owns several restaurants in the state.
Well, thank you for giving us that information. And there is a directive still in place for restaurants as to how they operate, their capacity, as well as the requirement for the staff to wear masks. And so there's a clear directive. And as you know, we've enforced that directive through actions of the Department of Health. Whenever there is an alcohol permit, it's also enforced by our ABC. And so and our information is there's a high level of compliance because there is a risk with the enforcement side. There's always presumably some outliers, but I think that's a severe minority, and we will take action and answer any complaints whenever we have that information. So thank you.
Governor, this is David Ramsey with the Arkansas Nonprofit News Network. You mentioned that at this point, all of the long-term care facilities have had at least one vaccination clinic. I guess, could you clarify or sort of translate that into the population level? Does that mean that all residents and staff who want a shot have had an opportunity to get a shot? And secondly, I know the CVS Walgreens federal program kind of operates differently and has been operating at a kind of slower pace. I guess, could you speak to why that is? What is causing that to sort of, in terms of getting shots into arms, that process to be a little slower? And specifically, there have been reports around long-term care facilities sort of having a more efficient or speedy process if they go to independent pharmacies as opposed to CVS or Walgreens. Is that accurate, and can you kind of speak to why?
Could we put the first slide back up on vaccinations? Okay. So you can see, first of all, you look on the left side, and with the doses that we're giving out, which is 392,000, that includes doses through our community pharmacies to long-term care facilities. And so we have that separate program that probably covers 60% of our long-term care facilities. As to the percent of the residents who get the vaccination, the pharmacies hold a clinic there. They have that partnership, they get the consents, they do all the things that are necessary, but there's always a few that say, no, we don't want the vaccine, or they don't get the consent. And so I don't have the exact number for that, but there's been a high acceptance rate among our elderly population in our long-term care facilities, and that's one of the reasons they go back for a second clinic for the second dose and to get those that were not vaccinated on the first one. On the right side, you'll see the question that you addressed in terms of Walgreens and CVS, and this is a federal program that goes directly to them. They were slow on the start, and then they were over allocated. That means they got more doses than was needed for the long-term care facilities that were assigned to them. And they've cooperated with us to give us some of those allocations back and to get those in the arms of 70 plus. And so people have a choice. They can go to multiple different pharmacies and see if they can get on a list to see what their supply chain is. And so, Colonel Ader, did you have anything you wanted to add to that? Thank you, sir.
So again, you know, the governor's absolutely correct. They were over allocated based on the number of licensed beds, and then a straight ratio on what staff, on a 1-to-1 ratio for every bed. There was one member of staff, so it was wildly over allocated. And then you have the hesitancy issue, so that it drove the numbers down a little bit more. So what you see here, and this is one of the things that I have to remind a lot of different people about, is that we give the shot, the prime dose, and then we have to wait a month for them to give us to give the second dose or the boost dose. Contractually, they were given 3 rounds of clinics that they have to go hit. And one of the things that's encouraging is the fact that in our second round clinics, we're seeing about a 30% uptick of people wanting the vaccine. So, once we got past the scary phase and people wondering if they should take it or not, we're seeing actually there's more demand there. So we've retrieved back. So we're trying to really, really kind of drill down on how much we can take back. But we're going to see this difference for at least another couple weeks. But you will see, as you can see right there, just yesterday we gave almost 1,000 doses in those programs. And so I expect that as we go through the second doses, we'll see that continue to grow.
Let me take advantage of the question, and as I communicated to the administration today, that we're grateful for their partnership, but next week, whenever the manufacturing of our vaccines increases and there's extra supply, they got a choice to make. They can do it through a separate allocation, such as they did here, or through the community health centers, or they can increase the allocation to the state. And I advocated for just increase the allocation to the state, and we can manage the program. We're very efficient in getting it out, and so give it to us, and we can make the decisions as to making sure it's equitable, which we're working toward, but the efficiency rate is best if you simply coordinate it and give it through the states and increase our allocation. So it's been a great partnership. It will continue to be, but I did have that message, and I think that's important. Next question.
Governor, this is Samantha with KNWA. I'm wondering about vaccines in special care facilities. I've talked to an oncology clinic who's requested vaccines to give to patients who are eligible right now, but the clinic hasn't gotten their shot, so their patients over 70 are having to find them elsewhere, and they're on long wait lists. Is there any update on if and when these clinics will get these vaccines for patients who are eligible?
Colonel?
Thank you for the question, because we have been discussing this quite a bit. And so the short answer is we just don't have the volume to be able to support all the different clinics or all the different providers that want to give vaccines. We are certainly bringing into our long-range vision to be able to bring in those clinics and community hospitals so that we can get at this population. Because, you know, when we look forward to the time when we're starting to get into the 1C population and we're dealing with comorbidities within the population, we want to make sure that we're using our physicians to prioritize who needs the vaccine first. And so that is certainly something we're working towards. As volume increases, we're going to be pushing more and more to these networks and community hospitals going forward.
Next question.
Good afternoon. It's Brett Rains with 4029 News. According to the new report released by the UAMS, they say that we're currently in the eye of a hurricane. Do we think the worst is behind us, or do we expect another big increase? If so, and why? And then second question is, we're hearing from local pharmacists who say they're overwhelmed by giving the vaccine shots. They're doing the most they can, but what else can be done with that? Thank you.
Well, in terms of our pharmacies, it's a big project to give tens of thousands of doses out over the course of weeks. And so we appreciate them, but that's one of the reasons, as Colonel Ader said, that we want to have additional clinics. We want to have additional means of outlet and access for our Kansans to get their vaccination. So we'll be increasing that as the supply increases. But the pharmacies, they value that. I think it's rewarding to them, and they're a good partner for us. In terms of the first question, if there's one thing I've learned through the course of this pandemic, and that is it's hard to predict the future as to where the cases go and what whether we're in the eye of the storm or whether we're on a downward slope right now. And so we just have to stick with our individual discipline on mask wearing. That is the best assurance that we're not going to have an uptick in cases. But I want Dr. Romero to comment a little bit more, because I know that one of the factors is if a variant shows up in Arkansas, or if there is an impact from the Super Bowl that we won't even know for some time yet. Dr. Romero?
So I certainly think that, I haven't seen the report, but certainly one way of classifying our reduction in cases at this time could be that we're in the eye of a hurricane, although I don't think so. I think that we have driven this downward, the cases have gone down, but we have the opportunity now to get ourselves in a situation where we can prevent more cases, where we can continue with these mitigation measures. That is the most important thing that's going to get us through any new variants that come on, because those are the ones that we can mitigate with standard 3 measures: washing our hands, watching our distance, and keeping our masks in place. There will be variants. We'll have to see where they're going. We are seeing certain variants increasing doubling time every 10 days, so they will eventually get here. Right now, they're not. We haven't found any. We keep sending specimens to the CDC. We're looking for them, but that will not change our strategy. Our strategy still remains vaccinate as many people as we can, keep the number of individuals to as low as possible where the virus can't replicate, and then keep the mitigation measures going. We can keep this under control.
Any other questions? Good. Anything else on the table? You good?
You're talking about the CDC guidance on second doses. Do you know anything about what the protocol will be for that? Like how long you have to wait before you use the second dose for a first dose?
Well, of course, we'll have to wait for the CDC guidance. But so I am repeating what I understand from the coronavirus task force today, that there'll be, which basically is if it's 10 days after the second dose is due, then they will use that dosage for others. And that's, a 42-day time frame if it's a 8-week time frame to get the second dose. So let's wait for the CDC guidance, but that's approximately the time frame that I understand will be provided. With that, thank you, and I want to thank everybody for being here today.